Welcome to the Advanced Tool Health and Life Coach Certification. Today we're discussing illness-specific health coach certifications, more specifically health coaching for arthritis and joint health. Introduction. Arthritis is one of the most pervasive chronic conditions globally, affecting more than 350 million people. It's not a singular disease, but rather an umbrella term for over 100 types of joint-related disorders. Common types include OA, RA, and gout, each presenting unique challenges and impact on joint health. These conditions can lead to persistent pain, stiffness, swelling, reduced range of motion, and overall diminished quality of life. Key points. Understanding arthritis and its types. Types of arthritis. To effectively coach clients, it's essential to understand the primary forms of arthritis, as each requires a nuanced approach. OA, also known as osteoarthritis, known as wear and tear arthritis. It's caused by progressive breakdown of cartilage that cushions the joints, commonly affects weight-bearing joints like knees, hips, and spine. Symptoms include joint stiffness, swelling, and reduced range of motion. Risk factors include aging, obesity, joint injuries, and repetitive strain. RA, also called as rheumatoid arthritis, is an autoimmune condition where the immune system attacks the joint tissues. It leads to chronic inflammation, pain, and joint deformities over time. It can cause systemic symptoms like fatigue, fever, and anemia, and risk factors include genetics, hormonal imbalances, and smoking. Gout is a metabolic form of arthritis caused by uric acid crystal buildup in joints. It primarily affects the big toe, but it also involves other joints. Triggers would be rich purine foods like red meat and shellfish, sugar drinks, and alcohol consumption. Psoriatic arthritis is a condition linked to psoriasis, causing joint pain and skin irritation. Often affects small joints in the hands and feet. Causes and contributing factors. Beyond genetic predisposition, arthritis can stem from multiple modifiable factors, including obesity, as excess weight strains the joint cartilage, repetitive overuse that jobs and activities do, which involve repeated movements like strain joints over time, poor diet, which includes high sugar, processed foods, and trans fats, and stress, as chronic stress elevates inflammation by increasing the cortisol levels. Joint health and pain dynamics. Healthy joints comprise of cartilage, synovial fluid, and sturdy ligaments act as shock absorbers that provide smooth movement. Arthritic joints exhibit cartilage thinning, inflammatory responses, and erosion of surrounding tissues. They result in pain, instability, and immobility. Key takeaway for coaches: while medical practitioners focus on disease-specific treatment, health coaches address the lifestyle contributors that fuel the inflammation and joint stress. Dietary recommendations for joint health. Nutrition plays a very important role to combat inflammation and support cartilage repair. Coaches provide practical guidance to foster sustainable dietary improvements that enhance the joint health. Anti-inflammatory diet principles. Increase your omega-3 fatty acids, which are found in fatty fish, flax seeds, and walnuts. It reduces the production of inflammatory prostaglandins, aiding in joint pain relief. Suggest easy meals such as grilled salmon with a side of quinoa and spinach as a tip. Add antioxidant-rich foods like berries, dark leafy greens, and brightly colored vegetables, which are rich in antioxidants like vitamin C, which aid in tissue repair. Impact is that it protects the cartilage from oxidative stress. Choose the whole grains over refined carbs. Refined flour products elevate the blood sugar, exacerbating inflammatory responses. Tip: you can replace your white bread with whole grain or sprouted grain versions. Limit saturated fats and sugary drinks. Avoid full-fat dairy, red meat, and sugar-sweetened beverages to reduce the systemic inflammation. And promote joint-friendly foods. Example: turmeric, ginger, and extra virgin olive oil. Tip: provide sample recipes like golden turmeric latte or ginger-infused tea. Hydration for joint fluidity. Encourage at least 8 glasses of water daily to maintain synovial fluid levels. Practical coaching suggestion. You can ask your clients to do mindful meal preparations, food logs, and flexible changes. Low impact exercises for arthritis. Physical activity is crucial for maintaining joint function and reducing stiffness. However, high impact exercises can further damage joints. Coaches should be helping the clients incorporate joint safe movements to enhance flexibility, strengthen the supporting muscles, and improve overall mobility. Recommended for low impact exercises: swimming and aquatic therapy. Water buoyancy reduces joint strain, improves cardiovascular health, and promotes full range joint movements. Yoga and stretching focuses on improving flexibility and easing joint stiffness. Example: chair modified yoga poses for older adults. Cycling, a low impact way to strengthen the lower body without putting undue pressure on the knees. walking on soft surface as it reduces the impact on joints, and encourage well-fitting walking shoes. Resistance bands training to build muscle to stabilize the joints without heavy lifting. Example, simple exercises targeting the knee or shoulder joints. Addressing limitations. Clients may feel apprehensive about pain during movement, so provide reassurance and suggest starting with 5 to 10 minutes of activity, gradually increasing the duration and intensity. Tracking progress. Encourage tools like fitness tracking or journals where the client logs steps, water workouts, or stretching sessions. Stress management and behavioral strategies. Stress often exacerbates arthritic symptoms. Coaches should be empowering the clients to reduce stress while fostering positive and sustainable behaviors. Mind-body techniques include mindfulness and deep breathing to reduce cortisol levels, meditation or guided sessions to offer easy access to relaxation practices, sleep as a recovery tool as poor sleep worsens inflammation. Recommend sleep hygiene practices such as reducing blue light or creating a calming pre-sleep routine. Behavioral support is focusing on small, realistic goals to combat feeling of overwhelm. Example, starting with 1 anti-inflammatory meal per day. 5. Monitoring and sustaining progress. Regular check-ins ensure that the clients stay on track and feel supported. Coaches should be recognizing these challenges and celebrate even incremental improvements. Track metrics like joint pain intensity, progressive mobility, and nutritional patterns. Celebrate the milestones, example when the clients make better choices, whether completing stretches or meal prepping. Best judge of the goals. Arthritis and joint health management requires an interplay of multiple strategies harmonized to create relief and promote client empowerment. Being the best judge of the chorus brings together the following principles. Tailor interventions to individual needs. Recognize that no two arthritis cases are identical. While one client's primary trigger could be stress, another one may be struggling with diet-related inflammation. Celebrate the progress no matter the size. Arthritis management is about small, incremental wins that lead to monumental changes. Whether it's walking an extra 5 minutes or sticking to a meal plan for a week, every step is significant. Integrate evidence-based strategies. Stay updated on the latest scientific research regarding anti-inflammatory diets, groundbreaking friendly exercises, and stress management techniques. Foster trust and encourage long-term goals. Arthritis is a long-term and lifelong condition requiring cooperative partnership between both the coach and the client. Normalize setbacks as learning opportunities. Every client faces obstacles in their health coaching journey. Help them reframe the setback as part of the process. Let's have a look at some of the summary tables. Table number 1 looks at the type of arthritis and their characteristics. Let's have a look at rheumatoid arthritis as one of the examples. It's caused by the autoimmune disorder attacking the joints. Symptoms include swelling, fatigue, systemic symptoms, and common risk factors are genetics, smoking, hormonal imbalances. Coaching focus should be anti-inflammatory diets and stress management. Take a moment to have a look at the rest of the table. Table number 2 looks at the nutritional guidelines for arthritis management. Let's have a look at omega-3 fatty acids as one of the recommendations. Key nutrients are EPA and DHA. Example foods are salmon, mackerel, and flax seeds. Role in arthritis management is reduces joint inflammation and stiffness, and coaching suggestions is adding at least 2 servings of fatty fish weekly. Table number 3 looks at the low impact exercises for joint health. Let's have a look at yoga as one of the type of exercises recommended. Example chair yoga and modified poses. Primary benefits is that it improves the flexibility and reduces stiffness. And frequency recommendations is 10 to 15 minutes daily. Coaching advice is guiding the clients to use supportive props like blocks or cushions. Table number 4 looks at stress management approaches for reducing arthritis symptoms. Let's have a look at progressive relaxation as one of the techniques. It works by targeting the stress by relaxing individual muscle groups. Example, audio-guided relaxation exercises. Benefits to joint health: it promotes blood flow and reduces stiffness. Coach recommendation is suggesting evening sessions to improve the sleep quality. Table number 5 looks at monitoring progress and tracking arthritis management outcomes. Let's look at joint mobility as one of the metrics to track. You can use functional movement test to track. Frequency could be monthly, and purpose is measurement in improvement or changes in movement range. Coaching applications: you can modify physical activity targets to optimize the gains. Let's have a look at some MCQs. Take a moment to answer question number 1 and 2. Take a moment to answer question number 3 and 4. And finally, number 5. Thank you.